Lockdowns are damaging, says Scott Moe. And Mark Friesen is responding to Scott Moe saying that lockdowns are damaging and they maybe don't actually work by saying, well, Mark Friesen says, wow, I was thoroughly vilified by him and his government, the media, and the trolls for uttering exactly the same words as he just did. I was ticketed and summoned 10 times for expressing the same at outdoor gatherings. Yeah, it's incredible. Here's the script flip, and Scott Moe is leading the way. Here we go. Maybe.
Now clear, at least in this Omicron wave of the pandemic, that lockdown policies can cause harm in our communities, often with little or virtually no benefit. They cause economic harm by taking away jobs and removing family livelihoods. They cause psychological harm by taking away social contact, most particularly for our youth. And they are an infringement on the rights and freedoms that we have come to enjoy and value as Canadians. And that's why they should only be used if absolutely necessary, and only if they can clearly be shown that they are being effective and they are working. And we're not seeing that as being the case today.
Wow. Sorry, I should have asked you to sit down.
But it's now clear, at least in this Omicron wave of the pandemic.
It's incredible to hear a mainstream politician articulating these things that, as Mark Friesen said, he was being ticketed and summoned for saying to people who supported him to continue to say that. And like, that's how politicians gain support, right? And so it's very interesting, the flip on the messaging here. And I noticed this kind of part of the way through yesterday evening, that it seems like there's a massive flip in messaging. There's a realization that generally the public is not doing this anymore. And so the government can't say we were wrong, because that would be admitting an error. And the government doesn't generally do that, in my experience. So I think the only way out of this is for them to say, oh, well, everybody's got it, and there's, yay, success, we beat the virus, right? But they're going to try and implement this crap with COVID restriction, or with climate restrictions. They're going to say, oh, well, all the things that we learned during COVID. So it's interesting, even more interesting, to hear Scott Moe talking about the infringement on basic rights and things like that, and how that all fits in. But the main conversation I want to have, now that Scott Moe's kind of said the quiet part out loud, right? He's admitted that there's not really a benefit to these lockdowns. There's not really a benefit to the economic disruptions they cause. All of this stuff doesn't work. And so continuing it is a farce. So now that we've got that admitted, how do we start looking at accountability? So how do we start saying, you said this was needed. You said this was the exit strategy. We spent trillions of dollars on this because you said this was the only way out of this. This is not the way out of this, clearly. Where's the accountability? What did you know? Because you said this for a reason. You didn't say this because everybody was expecting you to make shit up, right? You didn't say this because everybody was saying, we'd really like you to come up with a fantasy scenario and we're not actually going to listen to you. Like, people asked for advice and then implemented the advice. So what did you know? Why did you give that advice specifically? And we'd love to review your data, right? Now that we're out of the crisis. I don't think it's going to happen, but that's what I'd like to see. But is it going to happen? No, because the government's going to say, well, it was all necessary. There was an emergency, don't you know, right? Yeah, well, here's Quentin, and he says, lockdowns are to prevent ICUs from being overrun. So just in case you weren't keeping track, Justin Trudeau's government spent $1 million, 500,000 times in the name of COVID and increased the ICU capacity by 0 beds. You read that right. They spent $500 billion. Is that right? Hold on. Million is 6. Billion is 9, right? That's billion, right? Okay. I think so. It's 9 zeros after the 500. Right. So here we go. And here is Ontario. Do you know, like 8 days before Halloween, they reduced the ICU capacity by 1,000 beds, 38% of ICU beds closed overnight. 1,000 beds, about 1,000, 1,300 beds. So it's wild. here's the daily number of ICU available beds, and the numbers on the 22nd of October were 3,325, and the number of beds on the 23rd of October, 2020, were 2,061. So how does that work, right? Why did we lose all these beds? How are people supposed to be confident in a government that during a pandemic is not able to at least keep the ICU beds stable, right? Like, this is it inability to get materials? Like, do you not have enough beds, like physical beds, or do you not have enough sheets to put on the beds, or is it staff specifically that you don't have, right? Like, what's the choke point? And in that choke point, then you start to have answers, right? If you realize that they don't have the staffing, then you ask the bureaucrats who are in charge of that, why didn't you have the staffing? And they say, well, there's no nurses who are unvaccinated because we fired all the unvaccinated nurses, and so we were short-staffed. But that didn't happen in October 2020. So where did all those beds go? I honestly don't know. I don't have an answer. But it seems like another one of those accountability questions that I'm going to be sadly disappointed with. Pierre Poilievre points out, well, he gets into fights, I guess, on Twitter with all sorts of different policy people, etc. And he's responding to Chris Biddle saying, Aaron O'Toole's finance critic retweeting Jordan Peterson and undermining public health while ICUs fill up fast. Where's all the beds? ICUs fill up fast. Yeah, they'd fill up fast when you have 9 beds for a province of, 15 million. Anyway, Pierre Poilievre responds and says, there's more brain power in Dr. Peterson's pinky finger than in all the bobbleheads of your Liberal caucus combined. As for ICUs, you guys added $500 billion of debt in 2 years, supposedly to fight COVID. How much intensive care did you buy with that? Negative? Just like the vaccine's efficacy? Negative. The Dean podcast says Dr. Moore is now in the position of having to caution parents against rushing to vaccinate their kids while having to reassure parents who did. Interesting. The whole vaccinating children thing in Canada, that's still an experiment, right? Like, there's not good data from anywhere about long-term safety of this in children from anything I've seen. Have you seen anything? Because I haven't seen... Even the Pfizer data, even the trials they claim to do, they have, it's usually on a sample of less than 5,000. And that means less than 2,500 kids are getting the shot. And they're basing all of their safety data on that. Like, that's what I've been understanding. Maybe I'm wrong. If I'm wrong, please do share. But as far as I understand it, the safety data is not very robust. And I think that most people would need more than the government say so to follow through. Because sure, the government can say it's safe and all that, but if you find out the hard way that it's not, you can't just replace what had been taken, right? And so is that risk worth it? I just don't understand, right? Even if there was a less than 1% chance, right? What if you're that less than 1% chance, right? What if there's so many what ifs, and I don't understand the mentality of the people willing to take the chance, right? Goodness me. Anyway, regardless, back to this. Quebec, and Viva Fry says, the new Quebec, courtesy of Francois Legault, and a beautiful prison. Right? So there you go. The license plate reads, right? I remember when Discover Ontario, I think that was yours to discover. That was the license plate thing, yours to discover. Now it's open for business, right? They're trolling us with every license plate. Goodness me, yours to discover, or open for business. BC, both of them are laughable these days. You can't discover Ontario. Good luck, right? Try and drive across the province. No, we were able to get to Port Elgin, I guess. So we were able to. Nobody stopped us even when there was a hard lockdown. There was the highways were busy, but the economic activity is really stifled, and it doesn't help. So how is this plan supposed to work? What is the exit strategy? BC Children's Hospital says, we are aware of misinformation circulating online on social media regarding children and hospitalization rates. We are not currently seeing a dramatic change in hospitalization rates in children due to COVID-19. We are continuing to monitor the situation. That's interesting, right? Having hospitals come out on social media to debunk social media posts, but it works the other way too. There was a doctor from Edmonton saying that there were a whole bunch of stillbirths in a Waterloo hospital, and to this day, haven't seen evidence, hospital numbers to back that up. Randy Hillier used that as well because of the doctor who was saying, Dr. Negesu, sorry if I've got that wrong, but he was talking about a high number, and then Randy Hillier used it, and still the hospitals put out a tweet just like this to debunk that information. So is it valuable to do this? Is it valuable to have the hospitals themselves be able to put this information out without any kind of backing up documents, right? Like, we're not currently seeing a dramatic change. So why not like publish the 5-year average and like current numbers to the current date, or like the last 6 months, last 12 months compared to a similar 12-month period in, the last 5 years. They could, right? I don't know. And sometimes I think it's interesting if you've got a company or something like that, if you've got a corporation or something like that, and you want social media done and you give it to the millennial intern, what are you thinking? Like, that's the public face of your company. It just drives me crazy. It's like, what are you thinking? Like this is probably some low-level person, not connected to the hospital management or something like that. And they're just saying, oh, they're saying what they're told, right? So anyway, it's not what people think it is, I think, when they're interacting with social media, like representative of like a municipality or a hospital or whoever. Usually it's not who you'd expect.